I want to go through the different subsets of PAD and the indications for and types of treatment for each. And, we can start with asymptomatic, but can we do a quick overview of the four subsets and just brush over just the different types of treatments that are standard for each? And then we're going to dig into the conservative approach a little bit deeper after that. But let's start with the four subsets. And would you mind just going through just an overview of the treatment indications?
So think of PAD and CAD, coronary artery disease, exactly the same, to be honest. There are thousands and millions of people out there that have blockages in their heart. They have no idea. They don't even know that they have blockages. Unfortunately, sometimes these patients end up with a cardiac arrest and they die. Many of us have had family members. My own father had a heart attack and died from it. We had no idea he had heart disease. He was 54 years old. So this is not, these are very similar disease processes, PAD and CAD. So when it comes to PAD, the first subset is the asymptomatic, the people that we have no idea that they are out there. That's one subset. And under that subset, there is a cohort that we don't know they have PAD because they have never been tested. And there is a group that they have been tested and we know they have PAD. So let's call them asymptomatic. I would say even there's two categories. I would say the unknown and then the asymptomatic. So we know they have PAD, but they have no symptoms. Then we have the category of symptomatic PAD, which is the claudication. That's the group of patients that I said. These are patients that don't have ulcers or gangrene. These are people that they walk, they get pain, they get symptoms, they sit, they rest, the pain goes away. So that's symptomatic PAD. Then we have a third group that we call chronic limb threatening ischemia, CLTI, or critical limb ischemia, CLI. The nomenclature, as you know, Kim, has changed a little bit here and there, but it's all the same. These are patients that have ulcers and gangrene. They have a skin breakdown. Many of them, 60, 70% of them are diabetic. Some of them have chronic kidney disease. Some of them have both. Some of them are on dialysis. These are patients that have a lot of risk factors. They have hypertension, they have smoking history, or they are active smokers. They have high cholesterol, diabetes, like I said, so on and so forth. These are the CLI or CLTI patients. That's the third category. And then the fourth category is what we call the acute limb. This is a very special category. We compare this to acute MI, when people have a heart attack. That's our heart attack of the leg. These are patients that suddenly something has happened to their leg, acutely, suddenly, within the last 2 weeks. And they have become now symptomatic with lack of blood flow. These are patients that are eminently at risk of losing their leg. And they need immediate, urgent, emergent attention to save their leg. So those are the four categories: asymptomatic PAD, symptomatic PAD, claudication, critical limb ischemia, people with ulcers and gangrene, and then those with acute limb, those that suddenly present with a sudden pain and discomfort in the leg, and they have a sudden event that has caused cessation of blood flow to their leg, and they need immediate attention and revascularization.